Dr. Alan Muskett of Billings Plastic Surgery, and we're here today to discuss abdominoplasty, also known as tummy tuck. I'm here today with the world's greatest plastic surgery nurse, Tricia Kelly. Try to give you an idea of what's involved in a tummy tuck and what technical points there are and what you might need to know about it. So I'm going to start off first, and I'm going to ask Tricia, basically, why does somebody have a tummy tuck, and who needs a tummy tuck?
Probably the most of the patients that we see that are seeking tummy tuck are women that had babies, is a big chunk of who, me included.
Big babies? I don't think most babies are that big.
Well, yeah, so you have multiple babies, the skin gets stretched, the muscles get spread apart from the pregnancy, and that obviously can just kind of blow your stomach apart.
It sounds to me like there's two components to a tummy tuck. First of all, there's excess skin, which is generated by expansion of the abdomen. And there are a couple reasons that it can occur. Pregnancy is a common one, because you think about a baby and then all the stuff around the baby, that's a pretty good, what we call tissue expander. The other thing that can occur is people can get a lot of excess skin through weight gain.
Yeah.
And we see a lot of people with excess skin after massive weight loss. And what Tricia's implying is there's two components to the abdominal wall that we consider. One of them is excess skin, the kind of skin that you can pinch and pull out, have stretch marks on it, hanging over your belt, despite your weight loss, despite your exercise, all that stuff hanging out. And then there's also the component of the muscles, the abdominal muscles here, which become stretched and separated. And as part of the tummy tuck procedure, what we do is bring those muscles back together, and it strengthens the core of the abdomen and can also support the lower back. At the same time, we take the excess skin and stretch that down and remove it, so that not only is the abdominal wall corrected, but the excess skin is removed. And generally that involves an incision from one edge of the hip to the other, from the iliac crest to the iliac crest, and that's where the incision goes, and that allows for removal of the excess skin, and all the other work is done under the skin. And generally the operation takes about 2 hours. And how would you describe the recovery from that procedure?
The recovery, I would say, most likely is anywhere, I tell most of our patients about 2 weeks is average, give or take. Some could be a little sooner, some could be a little longer, depending on the degree of repair that needed to be done. But, on the average, probably 10 days is...
And how would you describe recovery? Does that mean that you can go back to work? Could you have worked at 10 days or 2 weeks? Or?
Yeah, so definitely depending on what type of work you do too, it makes a big difference. Whether it's pretty physical, that obviously you may need to wait a little longer to get back into the swing of work. But for the most part, at 10 days, you can move around. You can, you might only have to do maybe half days for a few days, back into maybe full time at 2 weeks.
Now, what about running? Would you say? A lot of people like to run. When do you think that you would have been comfortable running after this procedure?
Probably, I'd say most people are anywhere between 2 to 3 months.
So you can walk, do the elliptical maybe, or
yeah, you could do elliptical.
Okay.
You could do the.
And how about postoperative pain? I know a lot of people, that's a consideration with any surgical procedures. How much does it hurt?
It's a big procedure. I mean, there's a lot of work that actually happens with that procedure. You're dealing with muscle, which in a full-blown abdominoplasty, that kind of elevates your discomfort and in recovery. So, pain-wise, it's probably middle ground in comparison to, say, if you were going to, compared to orthopedic procedures versus, minor procedures, probably middle ground.
Okay.
discomfort.
And then, so would most patients be taking pain medications like Percocet or Vicodin for a few days or for a week, or what would you guess there?
I'd say the average is about 5 days.
Okay. The other thing that goes along, usually there's a drain tube used, which is in somewhere around, what would you say, 5 days, 7 days, something like that?
I think the average, it depends, anywhere a week to 10 days is
Okay.
probably about average.
All right. And so the procedure itself takes anywhere around 2 to 3 hours in duration. It is done with a general anesthetic, that is, a patient will go to sleep, and it's almost always an outpatient procedure. Now, can a person combine this procedure with another procedure, for instance?
Yes, they can. Yeah, absolutely. We do a lot with, we'll combine what we call the mommy package, tummy tuck in, some breast work, whether it's implants or a lift or whatever that needs to be addressed. But that's the most common combo of procedure with a tummy tuck. So, yeah.
And so that might, if a breast augmentation might add an hour to that procedure. So that generally we like to keep those combined procedures to about 3 or 4 hours. So commonly we'll combine a breast lift or a breast augmentation with a tummy tuck, occasionally some suctioning if it's necessary, the flanks or legs. And so those things can be combined, and that can make it considerably more economical. Now, how would you describe things like scarring, for instance? Is it visible or invisible? How would you describe that?
Well, you'll definitely have a scar around your belly button because the belly button doesn't get relocated during the procedure, but it finds a new little opening within the skin after the skin's been pulled down. Then the stalk of the belly button pops and finds a new little hole that we, of course, make an incision and sew that up. So you'll have an incision around your belly button, and then the incision sits pretty low, on your abdomen to where most could wear a bikini bottom and feel pretty comfortable with that.
Now, you've seen a lot of people over the years with this procedure. How would you describe the general level of satisfaction?
Oh, I think it's high. I mean, it's a high satisfactory procedure. Most that seek it have thought about it for a really long time, and then once they finally decide, I'm going to do something about it, they're ready. And you just can't help but not love getting rid of extra skin and folds and excess that you can't do anything about, regardless of what you do. So absolutely, it's a high satisfactory procedure.
Yeah. I think the things that I'd want to know too, if I were having the procedures, first of all, is it safe? What could happen to me if I have this procedure? Generally, it's a very safe procedure. I think our philosophy in general is that if it's not safe, we're not going to do it. A lot of our patients are mothers with young children. They have families. They have responsibilities. So we design all of our procedures such that we're going to take a very minimal amount of risk with your life and your family. So that's paramount in our minds. Generally, problems with the procedure are related to the incision or the wound, and very often it's related to patient factors. We really insist that people quit smoking before the operation because that really increases the risk of wound problems. Diabetics are going to have a little bit higher risk of wound infections. People who are heavy, who have a significantly higher body mass, are going to have more problems. Generally, a slender patient with excess skin and some weakness or abdominal wall have a very low risk of wound infection. Because I think we work very efficiently and quickly, we have very little trouble with things like blood clots, problems like bleeding, or other complications. So I think in general it's very safe because we feel like the only way to do it is to do it safely, because we can't take risks with our kids and our families and things like that. Another question that comes up is how much does it cost? The total package, depending on what factors there are, generally runs somewhere between about $8,000 and $9,000. So that means anesthesia, facility, surgeon's fee, garments, things like that. It's going to be roughly in that range. And then if you want other procedures done, that's obviously going to increase the cost. But for tummy tuck alone, probably somewhere around $8,000 altogether as a package would be a realistic figure. I think too that is there anything after this that a person can't do? Is there anything once you're all healed up and strengthened? Is there anything you can't do?
I mean, your abdominal wall will be a little weak, for just because it's been manipulated and repaired, and so getting that initial kind of strength back will take a little bit. We typically don't want you doing anything really heavy core-wise, that being exercising for at least 3 months, just to allow the scarring to do its thing and not allow any mishaps during exercise. But really, once you get past that and you get back on your feet with normal exercise, and the show goes on, and you do whatever you want.
Okay. I do think a person can maintain their fitness well, even right after the procedure. There's no problem with walking as much as you want to after the operation. It's just mostly the straining of the abdomen or maybe the jiggling. I think aerobic activities with frequent repetition and low load are certainly acceptable. So our really athletic patients who want a tummy tuck find that they can maintain their fitness throughout just by using light activity with high repetitions and a lot of aerobic capacity. But other than that, I think people are able to maintain their fitness very well following surgery.